Hello student, today we are going to discuss how to take history in pediatrics. First of all, we will approach from the right side towards the patient. We will introduce ourselves and will take consent like this that I am Dr. ABC and I am going uh, takes to take a history to ask some question from you and to examine you, and in this time if you feel any pain or any discomfort, you can easily talk to me, you can easily tell me that you are feeling uncomfortable. This will be the consent taken from the patient. After that we will start our history from biodata. First of all, we will ask about the name of the patient, the age of the patient, the gender, his or her father occupation, to know about her financial, his or her financial conditions, his or her address, date of admission, time of admission, mode of admission, either the patient presented through OPD or through emergency. Mode of admission is very important. If the patient is presented through emergency, we will deal the patient promptly. But if presented through OPD, we will deal slowly, and we can take a bit we can take some time also. Then we will ask the chief complaint from the patient, and we will write our chief complaint in the chronological order in which the complaint which have of more duration will be written first, and the complaint which is recent and of less duration will be written last. For example, if the patient is complaining of loose stool from past 7 days, we will first, or for from past 5 days, we will first write about the loose stool. If he is vomiting from the last 4 days, then we will write vomiting. And if the patient has fever from the last 2 days, we will write it at the end. This is called chronological order. Then we will elaborate our chief complaints by the history of presenting illness, in which we will ask about different things, for which I have made a mnemonic DOPSAR. In DOPSAR, we will ask about the duration of the first. Our first chief complaint is loose stool. We will ask about the duration of the loose stool, the duration of the vomiting, and the duration of the fever. Then we will ask about the onset, that either it is of sudden onset or gradual onset. Then we will ask about the progression, that either the disease has increased or decreased with time, that it has progressed with time or decreased with time. Then we will ask about the site involves. Then we will ask about the severity, either the severity is more at night, during daytime, during activities, or even at rest. Then we will ask about the aggravating factors and the relieving factors and the associated symptoms. Suppose the chief complaint of my patient is the loose stool. The symptom associated with loose stools are vomiting, diarrhea, maybe constipation, maybe abdominal pain. So I will ask about the associated symptom and the medication recently used, or have the patient ever visited to any other clinic or any other doctor before. Then we will take a review of the then we will take a systemic review of the patient, in which in the CVS we are going to ask about shortness of breath on exertion, cyanotic spill or blue spill, which comes in the patient top, tetralogy of palate. It is common in children of tetralogy of palate, so we have to ask about the cyanotic spill. We have to ask about fainting, edema, and syncope. In the respiratory system, we have to ask about sore throat and examine the sore throat of the patient. During examination, we have to ask about earache, cough, chest infection, hemoptysis. In the gastrointestinal system, we have to ask about the abdominal pain, vomiting, diarrhea or constipation, blood in stool. In the CNS system, we have to ask about fits, because more children's at childhood age, they present with fits and seizure. It is very common in the child age group. Then we have to ask about headache, dizziness and visual problem, as well as we have to ask about the test of the patient urinary system. We have to ask about the dysuria, which is painful urination, frequency, nocturia, which is urination in at night. More frequency of urine increases at night is called nocturia. Hematuria, blood in urine, we have to rule out the hematuria. Then in the musculoskeletal history, we have to ask about the muscle cramps, the joint swelling, dry eye and dry mouth, which is common in Sjogren syndrome, and rash, which is common in SLE with a joint involvement. In the past medical history, we have to ask about previous hospitalization, previous medication used, previous major illnesses, and any transfusion past in the past surgical history. We have to ask from the patient about some cardiac surgeries which the patient have done, or any procedure done up to till now. Then we will go towards the birth history. In the birth history, first of all, we will ask from the mother about the antenatal history, about the health and the nutrition of the mother, the illnesses during pregnancy, which are hypertension, diabetes, preeclampsia and eclampsia. Then infections during pregnancy like UTI, urinary tract infection, rubella, syphilis, and drugs taken, that is multivitamins taken, which usually pregnant women takes in the first trimester is iron supplements, and in the second trimester they usually take calcium supplement. And any radiation done in during the pregnancy, and TT injection done in the second and the third trimester, we have to ask about this. Any past obstetric history, stillbirth history of stillbirth, miscarriages. And in the natal history, we have to ask about the place of delivery, where the delivery has been conducted, in the hospital or in the home. Place, home or hospital. In the either conducted by a doctor, a trained health visitor, or by a midwife. Sterilization techniques used for instrument or not. Gestational time, either the pregnancy was term, preterm or post-term. Rupture of membrane, either premature rupture of membrane or post mature rupture of membrane. Labor time or induction of membrane. Labor time, either premature labor or post date labor. Presentation and type of delivery, that is mode of delivery, either normal vaginal delivery done, C-section done, or possible delivery or vacuum delivery done. Then any sedation and analgesia taken during labor, like epidural analgesia. Usually women choose epidural analgesia. We have to ask about this. And any complication during labor, we have to ask about this. And postnatal complication, we have to ask about the immediate cry of the of the baby, to ask about the basic problems like resuscitation, cyanosis, respiratory problem, or if the baby has cried or not, birth weight, birth injuries and convulsions at the time of birth, cyanosis, rash, jaundice, fever. And procedures like umbilical artery catheterization, drugs and exchange transfusion used in the delivery. In the feeding history, we will ask about that, after how many hours she has started to first feed the baby. Just after usually just within the 30 minutes after birth, it is better to feed the baby, because there is colostrum in the mother milk, which provides a prolonged immunity to the baby. So we have to ask about feeding within the 30-minute. Type of feeds now using bottle feed or breastfeed. weaning, either the mother has start weaning to the child or not. Usually weaning start at the 6 month of age. Current diet contain food, vegetables, or only bread, and which type of material her current diet, the patient current diet contain. Immunization history: did the parent immunized their children or not? Age at which immunization start: usually start at birth from BCG vaccination. Dose and adverse effect. Developmental history: in developmental history we have to ask about the smiling, which usually occur at 6 week, about ability to hold the neck, which occur at the 3 month setting, which occur at 6 month, crawling at 18 months, stand the at 1 year of age the baby is able to stand, walk at 2 year of age the baby can walk, talk at 1.5 year of age the baby is able to talk, and control of bladder and bowel function is at the age of 3 year. Past history: in the past history, as we have already discussed past medical and past surgical history, we have to ask about personal history, the particular habits, the detail of schools, his studies, his performance in the studies, and his behavior with the child. Either the child is socially isolated, or he is a joyful child, play with other boys and cooperate in different activities. And we have to ask about the drugs till used now, and allergy, and either the child is allergic to any drug or not, or the mother is allergic to any drug or not, or the which drug the mother have taken at the time of breastfeeding. In the family history we have to ask about the age of the mother, marriage since, cousin marriage to rule out any thalassemia minor trait or minor trait. For that we have to ask about the cousin marriages. Parent health, siblings, how many childs are they, and age, number, sex, illnesses, any death, stillbirth or miscarriages. Grandparent health, family tree. Socio-economic history we have to ask about the education, occupation, family income, house hygiene, source of water, because source of water is important to rule out gastrointestinal infection which spread through fecal-oral route. Any pet at the home which is responsible for causing asthma and any type of allergy to the patient. And occupation is important to know about that, either the family can afford the expenses of the hospital or not. And in the family tree, square is used for a male baby, and for female baby circle is used for twins. This sign is used. Thank you. If you like my video, subscribe the channel